Welcome to all viewers and well-wishers of the world. The purpose of my lecture is learn the knowledge from the word, return the knowledge to the word. Motto of my life is learn, earn and return. I have learned a lot, earned a lot, now to return a lot to the word. The topic of today is freckles. What are the freckles? Freckles, the other name is aphylides or aphylis. Most common extra patches of the coloring or the pigment under the skin. Freckles are the clusters of the concentrated melaninized cells most visible on people with a fair complexion. Freckles do not have an increased number of melanin producing cells or the melanocytes, but instead have melanocytes that overproduce melanin granules, which are called melanosome. So there is increase in melanosome, not an increase in melanocytes. So the changing coloration of the outer skin cells, keratinocytes, is the freckle. Here one can see the freckles as one can appreciate on the fair skin. So these are all the freckles. Now, one have the freckles because of the genes one have at birth. Freckles often show up during the childhood. One get more until one is 20-year-old. People with fair skin or red hair are most prone to have freckles. Freckles are different from lentiginous and moles, which are caused by accumulation of the melanocytes in a small area. Here, there is the accumulation of the melanosomes, not melanocytes. Freckles can appear on all types of the skin tones. Of the 6 Fitzpatrick skin types, they are mostly on the skin tones 1 and 2. So here are the Fitzpatrick skin tone scale, that is 1, 2, 3, 4, 5 and skin 6. Number 1 is very fair, always burn, cannot tan. Number 2 is just fair, usually harm, burns, sometime tan. Then number 3 is medium, that sometime burns, usually tan. Number 4 is olive, rarely burns, always tans. Number 5 is brown, never burns, always tan. And number 6 is black, never burn, but always tans. So it is mostly seen in fair skin color people, the freckles. Now, types of the freckles, there are 2 main types of the freckle. One is called aphylides and other is called solar lentiginous. Although both are flat spot, they are different in a few ways that I am going to tell you just now. So number 1 is aphylides, a freckle flat and light brown or red and fades with a reduction of the skin exposure during the winter, more common in those with light complexions. The regular use of the sunblock can inhibit their development. Here one can see this type, and with the use of the sunscreen one can just avoid the appearance of these. Now, aphylides are genetic, inheritable, first show up when 2 to 3 years old, often after one is in the sun, are usually on the arms, chest, face and neck, can go away with aging, are usually about 1 to 2 millimeter or bigger in size, have irregular borders that are not very well defined. The other form is the solar lentiginous. These are also called age spots, sunspots, or the liver spots. They look like large freckles form after years of the exposure to the sun. So that is, the size is larger than the aphylides. Here one can see the sunspot, solar lentigo, and here again the solar lentigo. These are of larger size as compared to aphylides. So solar lentigen is seen as one get older at 50-year or plus age group, can be anywhere on the body that gets sun exposure like back, chest, face, forearms, hands and the shins. They do not fade or disappear. They are light yellow to dark brown in color and they have got clear borders. So that's the difference. My mom said, follow your dreams. So I went back to bed to get those dreams which my mother have asked me to follow my dream. So that is the reason of not doing the job and following the mother's saying, but basically you are not interested to do hard work. Now, freckles versus lentiginous sunspots. Sunspot or lentiginous, also called age spot or liver spots, they can look tan, brown or black, seen in people who are 50-year or plus age group. Rarely in younger people, sunspots are caused by too much pigment stuck together in one area of the skin. This happens too long exposure in sun. Tanning beds can also cause sunspot too. Here one can see the types of the freckles. I have already told you, aphylides and the solar antigens. And aphylides, as I have told you, these are the smaller in size, 1 to 2 millimeter, and the solar antigens are usually the larger. And here there is the difference between moles versus freckles. Moles, as one can appreciate, everybody have got the moles in his or her body, and that is different. So one can have the aphylide or the solar antigen, which can be easily differentiated by the size and appearance. Now, freckles versus lentigen sunspot. More sunspot present on parts of the body that get sunlight, that is present on hands, feet, face and shoulders. Spots are large as a half inch across and sunspots are usually harmless. Prescription cream can lighten them, sometime can be removed if they look bad cosmetically. Have a doctor check out any dark spot on your skin so that you can come to know whether it is freckles, lentiginous or mole. So here one can see the melanocytes which are producing the pigment. So that normally these melanocytes not producing the much pigment, but in freckle, as you can see, the sum of the pigment is being produced, and in lentiginous the more pigment is being produced. So here one can see the lentiginous. Now, freckles versus moles. One can mistake moles for the freckles. Moles, also called the nevi. Moles have bunch of the skin cells clumped together. One can find moles everywhere on the body, on scalp, between toes and under the nails. Almost every person has few moles in his or her body. Even having dozen is normal, more prominent on the light skin, but these are not very dangerous. Moles look round, flat or slightly raised. They tan black, red, pink, blue, skin toned or colorless. Most moles do not need treatment. If one do not like it, can be removed cosmetically to look good. It can cause a scar or infection. Any change into a mole gets itchy or started to bleed or size increases or any abnormal discharge from that is the early sign of the skin cancer, which is the melanoma. So, do biopsy to rule out this possibility. Hair mold versus freckles, as one can see the mole, and here one can see the freckles, the dark spots on the face, nose, and chin. And here again one can see the dark skin, the freckles, and that is the difference between the mole, the cluster of the melanocyte giving the appearance of the mole. And now here the freckles are small brown spots usually found on the face of or arms, extremely common as one can see. Causes and the risk factors. The harmful rays of the sun can make the freckle darker, more likely if one have light skin. Too much sun cause skin to become tan, sunburned, and blotchy. Emotional stress is also factor. Infectious diseases and different medication and any liver disease, these are all responsible for the cause and the risk factor of. Now, reasons of the freckles, as one can think of genetic factor, ultraviolet radiation, then diseases of the kidney or the liver, some medicine which is being used, and other peeling substances which are used, and much stress. These are all responsible and reason for the freckles. And here again, the causes of the freckle, it causes excess solar radiation, gallbladder disease, liver disease, some infectious diseases, then lack of the vitamins and the minerals in the body also responsible, taking different medications as their side effect, and hormonal imbalance and intense emotional stress and excess solar radiation. These are the different causes of the freckles. Now, causes and risk factors, as I have already mentioned, these are hormonal imbalance, vitamin and mineral deficiency, and gallbladder disease. These are all notorious for causing the problem.